Welcome back to the Arizona Daily Mix. Dr. Rizik is back with us as we prepare for another procedure. And this one is very important. And I want everyone at home to be listening, especially today, because we're going to talk about heart problems with men and women, but women especially, because I'm going to say this, and I saw this report that they were kind of ignored when it came to heart attacks because they either said, oh, you're just stressed out, or it's heartburn, or you're just worried, and they would be kind of pushed off to the side, and then they pass away. You're stopping that, and that's one thing you want to make sure.
The myth of the last 100 years in medicine is that women don't develop heart disease, and nothing could be farther from the truth. Women absolutely do develop heart disease. There are some differences. One of the basic differences, if you look at men and women at, say, age 35 to 40, clearly men have a higher rate of, say, coronary artery disease than women. As we get up into the 60s and 70s, there's a catch-up phenomenon. Women start to develop more disease. When we talk about the symptoms of heart disease, most of the symptoms, the classic symptoms we talk about, chest pain or chest pressure, more common in men. Women have different symptoms. They may feel shortness of breath. They may feel fatigue. The symptoms between men and women are very different, and you have to be very discerning when you talk about the symptoms of women and heart disease. Yeah. Another very important thing, many years ago, when men represented a greater population of smokers, for instance, in the United States, yes, men had a higher rate of coronary disease. As in the 80s and 90s, more women were smoking, the heart disease rate amongst women increased. Wow. So very, very important not to forget that women do develop heart disease. There are symptomatic differences, age differences, but there is nothing more important to me in medicine than understanding that coronary disease does occur in women, and we have to be very critical in our thinking.
Yeah, and that's why the procedure that we're going to be performing has been done on both men and women.
No question.
And it's a very important one that, again, I speak about, say again, my father, a heart disease, had heart problems, heart attacks, and everything from actually what we're talking about, and that is the arteries closing up. So we're going to be talking with the procedure about putting in a stent and then putting in is it the stent that we're putting in?
We're going to put in a stent.
But it's a special kind of stent, like different.
Right. So a little bit of background. When we first started doing balloons only in the coronary arteries, the reclosure rates, the arteries would reclose at 40 or 50% over 6 or 7 months. Then we started putting stents in, and that number dropped to about 20% at 6 or 7 months. But now we have drug-coated stents that not only maintain the integrity of the artery, keep the artery open, but the drugs that are lining those stents are anti-inflammatory drugs, and they further reduce reclosure rates to maybe single-digit percentage.
Wow.
So we've gone from doing bypass only on patients in the 80s and 90s, bypass is still a great therapy, to balloons, to metal stents, to now drug-coated stents. And the drug on those stents is just chemotherapy, chemotherapeutic agents, which help to reduce the inflammation in the blood vessel. So you and I have a lot to talk about over these next several weeks.
Yeah, we do, and I'm looking forward to it. And I appreciate you, doctor, because I sit here and I am not one of those TV people that want to say I know it all and I went and read stuff. I like hearing from you, and that's what you're going to get with us, is that I'm going to be like you, the viewer out there, asking the doctor the questions, might not understand the technology or what's going on, and that's what I like about sitting with you here, and each week is that you're educating me along with them out there.
So think about this. Pretend for 1 minute you were my patient. What we have to do, if you were my patient and you were sitting across from me and I were offering you various choices, you need to understand your choices. So what you and I will do over the next several weeks is educate each other and in turn educate the audience so that they understand their therapy choices.
I like it. Dr. Rizik, I'm looking forward to our next talk next week. I'm looking forward to this procedure, which is going to be amazing. And if you want to see the last procedure that Dr. Rizik and his team has done, you can go to aztv.com/procedure to see that whole event and our interviews too. So, Doctor, thanks for joining me. And we'll be back with more of Arizona Daily Mix after this.